Hey everybody, it is Dr. Hart, Nursing with Hart, PhD, and I just wanted to go over a few fundamental test questions. These are NCLEX-style test questions in the fundamentals category of basic care and comfort, specifically hygiene and self-care. So just to take a look quickly, this is exactly from the search that I did. The NCLEX exam structure has four main categories: safety and effective care environment, has protecting patients, healthcare personnel, as well as managing care delivery, management of care, safety and infection control, healthcare promotion and maintenance, has psychosocial integrity, psychological integrity, physiological integrity, has basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, psychological adaptation, the physiological adaptation. So if you need to see any of these and want to get some more details, the nursing website, Florida board or whatever board whatever state you're in, your state board of nursing website will have all of this information for you. So let's go on to the first question. The ability to bathe and perform normal grooming functions and to dress, feed, and toilet oneself is. Now these may seem to be very fundamental, very basic questions, but these are possible questions for your unit exams or even your NCLEX. So these are basic self-care questions in the hygiene and self-care promotion category. Okay, so the ability to bathe and perform normal grooming functions, and to dress, feed, and toilet oneself, and the key is in the stem of the question. Okay, is which one? A, hygiene, B, activity, C, self-care, or D, health? Okay, and I'll give you a minute to think about this one. In the meantime, if you're getting something out of these videos I'm doing, please like, share, subscribe to my YouTube channel, Nursing with Hart, PhD. I'm also on TikTok. I'm also putting these on TikTok under Suzy Q, and I will be putting some on Instagram as well. So let's go back to this one, the ability to bathe and perform normal grooming functions and to dress, feed, and toilet oneself is. Okay, this is all self-care. The word self is right there in the word oneself, so that's your clue. These are all the patient's ability to take care of themselves, okay? Normal grooming functions. Okay, and so let's go on to the next one. The first line of defense against microorganisms and infection entering the body is the person's what? So you may also get this if you're taking a other classes may come up in, and even in pharmacology or anatomy, physiology, any of those other classes, this content may come up. So the first line of defense against microorganisms and infection entering the body is the person's A, gastrointestinal tract, B, mucous membranes, C, hair, or D, skin. And I'll give you a minute to think about this one. Okay, and this one, the correct answer is D, skin. The skin is our first line of defense against microorganisms entering the body. Okay, next one. When the nurse cleanses the client's leg during a bed bath, it will allow for A, assessment of pain, B, increased circulation, C, decreased restless leg syndrome, or D, promotion of social interaction. And I'll give you a minute for this one. Okay, and this one, the correct answer is B, increased circulation. And when you're doing your skills on how to conduct a bed bath, the instructor should be showing you how when you're bathing the legs, especially extremities, arms and legs, you can rub going up. So here's the arm. Hold on, that's not a good arm. Let's rub the arm. You would rub going up toward the center of the body. Rub up, right? When you're cleaning, and that will promote circulation. And the same with the legs. You want to start with the feet, and you want to travel upward, okay, to the center of the body, and that will promote increased circulation. And it helps maintain muscle tone and joint mobility. Next one. On the first post-operative day, the client is assisted to the bathroom. It is important for the nurse too. So here is a safety, always thinking of safety when you're answering these questions. Okay, your priorities, your ABCs, airway, breathing, circulation. Always thinking about Maslow's hierarchy of needs, and always thinking about safety. And also think about the nursing process. Assessment, diagnosis, planning, implementation, and evaluation, which is the acronym ADPI. Okay, so your answer choices are A, allow the client privacy, B, assess the client's safety, C, assess the client's pain, or D, allow sufficient time. And I'll give you a minute to think about this one. All right, let's come back to this one. The correct answer is letter B. Assess the client's safety. Okay, always thinking about safety, especially when it comes to post-op. Okay, think about post-op. What's happening during post-op? Your client may have been anesthetized, may have been under anesthesia, whether it's local or general anesthesia. They may be still groggy. So it's very important. When I had my carpal tunnel and trigger thumb release surgery on Monday, I went to use the bathroom in the post-op area, and I had two nurses escort me to the bathroom. Not one, but two. They were going to be sure I was safe, and those are good nurses. Okay, I was very impressed with the nurses in that post-op and pre-op area also. Everything was wonderful. Okay, so always thinking about safety, the toileting function, especially post-op because of anesthesia or possible pain medications that might be making the patient drowsy or dizzy. Toileting is often associated with falls. The nurse must ensure the client's safety. Next one, when an adult client from Indonesia, so this is a cultural question, I like to ask these questions. When an adult client from Indonesia refuses a complete bath on the day after abdominal surgery, the nurse should A, understand the client's culture may influence the client's hygiene and ask them about their preferences. Letter B, ask another nurse to assist in giving the client a complete bath every other day. C, give the client a bath pan and tell the nurse will return when the client has finished. D, encourage the client to bathe daily as part of protection from infection. Okay, and we'll give you a minute on this one. Think about your cultural competency as a nurse. Okay, let's come back to this one, and the correct answer is A. Understand that the client's culture may influence the client's hygiene, and ask the client about preferences. Especially, take a look at the stem of the question again. They're from another country. You may not understand their culture. So, this is the day after abdominal surgery. Do they really need to have a complete bath the day after surgery? Many cultures, many other cultures, and many other people, especially elderly, typically don't bathe every single day. They don't take a complete bath every day. It's not necessary. And so the day after surgery, your client might be in pain, they may be uncomfortable, and they may not want to undress in front of you. So preferences for hygiene vary widely among individuals and across cultures. Next one, an older adult client is complaining of dry, itching skin. The nurse should assess A, how often the client is bathing, B, when the client's last tub bath was, C, what linens they are using, or D, when the severe itch occurs. All right, now I'll give you a minute to think about it. Okay, and this kind of goes back to the previous question, especially an older adult who's complaining of dry, itchy skin. So the correct answer is letter A, how often the nurse should assess how often the client is bathing. So bathing, especially with the older adult, every single day is not necessary, and it can, frequent bathing for the older client can dry out the skin and contribute to skin breakdown. Okay, so the nurse needs to assess how often the client is bathing, and you can let them know that it's really not necessary to take a bath every single day if they're having itchy skin. Last one, what type of bath is preferred to decrease the inflammation after rectal surgery? Okay, and you should be learning about this in your fundamentals class. Different types of baths. Okay, to decrease inflammation after rectal surgery. Letter A, bed bath, B, tub bath, C, whirlpool bath, or D, sitz bath. Okay, and the correct answer on this one is letter D, sitz bath. Sitz bath is a little, usually a little plastic tub designed for the client to sit on it, and this is used after childbirth to decrease inflammation, after rectal surgery, or to decrease the inflammation of hemorrhoids. And they are going to soak the pelvic area in warm water, and that decreases inflammation after rectal surgery. Okay, that's a sitz bath, letter D. And so that's it for today, and I'm going to do some more in just a few minutes. Take a look, check it out, and look out for some more. Have a great day.